In this video, we will be covering Raynaud's phenomenon or Raynaud's syndrome or Raynaud's disease. Raynaud's phenomenon or syndrome is an episodic vasospastic disorder of small cutaneous arteries, most often involved in the fingers and toes, that is brought on by an unusual sensitivity to cold, emotional stress, or autoimmune disorders. Raynaud's phenomenon is 5 times more common in women with the typical onset before age 30. Acrocyanosis has been thought to be a variant of the Raynaud phenomenon because both are aggravated by cold and emotional stress and both present with the blue discoloration of the fingers and hyperhidrosis, that is excessive sweating. Acrocyanosis is a poorly understood phenomenon that may be benign and require little or no treatment, or the patient may have chronic pain and ulcerations. There are 2 main types of Raynaud's disease. They are primary or secondary. Primary Raynaud's or Raynaud's disease or idiopathic Raynaud's disease occurs in the absence of an underlying disease. This most common form is in the result of another medical condition. It can be so mild that many people with primary Raynaud's don't seek treatment and it can go away on its own. Secondary Raynaud's, also called Raynaud's phenomenon. This form develops because of another health condition. It occurs in association with an underlying disease, usually a connective tissue disorder such as systemic lupus erythematosus, rheumatoid arthritis, or scleroderma, trauma, or obstructive arterial lesions or thyroid conditions. Although secondary Raynaud's is less common than the primary form, it tends to be more serious. Now, we will see the difference between disease phenomenon and syndrome. Raynaud's disease occurs on its own and isn't connected with another disease or condition. This is also called primary Raynaud's syndrome. Raynaud's phenomenon occurs due to an underlying condition, medication, or lifestyle factor. This is also called secondary Raynaud's syndrome. Raynaud's syndrome refers to either the primary or secondary form of the condition. What are the etiology or causes of Raynaud's syndrome? The cause is unknown, although it may be secondary to connective tissue and other immunological disorders. Experts don't fully understand the cause of Raynaud's attacks. Cold temperatures are the most likely cause of an attack. Examples are putting hands in cold water, taking something from a freezer, or being in cold air. For some people, emotional stress can trigger an episode. Primary Raynaud's syndrome has no identifiable underlying cause. An underlying disease or condition usually causes secondary Raynaud's syndrome. Diseases and conditions that can cause Raynaud's phenomenon or secondary Raynaud's are connective tissue disease. Most people who have a rare disease that leads to hardening and scarring of the skin, known as scleroderma, have Raynaud's. Other diseases that increases the risk of Raynaud's include lupus, rheumatoid arthritis, and Sjogren's syndrome. Next cause is diseases of the blood vessel. These include a buildup of fatty deposits in blood vessels, in which the blood vessels of the hands and feet become inflamed. Pulmonary hypertension that affects the blood vessels of the lungs also may cause secondary Raynaud's. Next condition is carpal tunnel syndrome. This condition involves pressure on a major nerve to the hand. The pressure causes numbness and pain in the hand that can make the hand react more to cold temperature. Repeated actions or vibrations like typing, playing piano, or doing movements like that for long periods can cause overuse injuries. So can using vibrating tools such as jackhammers. These also can cause secondary Raynaud's. Smoking also causes secondary Raynaud's. Smoking narrows blood vessels. Injuries to the hands or feet. Examples include a wrist break, surgery, or frostbite. Other disease conditions cause Raynaud's phenomenon are Burgess disease, cancer, dermatomyositis, hypothyroidism, peripheral artery disease, polymyositis, Crest syndrome, thoracic outlet syndrome, vasculitis. Medications and substances that can cause Raynaud's phenomenon or secondary Raynaud's are beta blockers for high blood pressure, some migraine medications containing ergotamine, stimulant medications like methylphenidate that treat attention deficit or hyperactivity disorder, some cold medicines or decongestants containing phenylephrine or pseudoephedrine, certain cancer medicines like bleomycin, vinblastine, caffeine, cocaine, epoxy resins, nicotine. These are the medicines and substances which can cause Raynaud's phenomenon or secondary Raynaud's. Now we will see the pathophysiology of Raynaud's phenomenon. Three main changes are seen in the mechanism of Raynaud's phenomenon, which are reduced blood flow, blood vessel constriction, and neurogenic, inflammatory, and immune responses. It is induced by mental stress and a cold atmosphere. Blood vessels in the hand and feet appear to react too strongly to cold temperatures or stress. In Raynaud's, blood vessels to the fingers and toes narrow when exposed to cold or stress. The narrower vessels limit blood flow. Over time, these blood vessels can thicken slightly and limit blood flow even more. The condition is a form of intermittent arteriolar vasoconstriction that results in coldness, pain, and pallor of fingertips, toes, or tip of the nose, and a rebound circulation with redness and pain. The pathogenesis of Raynaud's phenomenon is due to abnormalities in the vascular, intravascular, and neuronal mechanisms that cause vasodilation. In all cases, the primary cause is an underlying hyperactivation of sympathetic nervous system, although with different types, the exact pathophysiology differs. In the primary type, there is an increase in sensitivity due to mental stress and a cold atmosphere resulting in vasoconstriction. In the secondary type, normal activity of blood vessels is disrupted due to the same reasons causing vasoconstriction, which leads to ischemia and tissue death. Secondary Raynaud's is characterized by vasospasm and fixed blood vessel obstructions that may lead to ischemia, ulceration, and gangrene. The prognosis for patients with the Raynaud's phenomenon varies. Some slowly improve, some become progressively worse, and others show no change. Raynaud's symptoms may be mild so that treatment is not required. Symptoms may result from a defect in basal heat production that eventually decreases the ability of cutaneous vessel to dilate. Episodes may be triggered by emotional factors or by unusual sensitivity to cold. Now we will see the clinical manifestations. Raynaud phenomenon is characterized by vasospasm-induced color changes of fingers, toes, ears, and nose. As blood flow stops and then returns, the skin color may change from white to blue to red. The classic clinical picture of Raynaud's reveals by sudden vasoconstriction. Decreased perfusion results in pallor, that is white in color. The skin then becomes bluish purple because of a pooling of deoxygenated blood during vasospasm. These changes are followed by rubor, that is called red, a hyperemic response when blood flow is restored. As a result of exaggerated reflow, that is hyperemia, due to vasodilation, a red color, that is rubor, is produced when oxygenated blood returns to the digits after the vasospasm stops. The patient usually describes coldness and numbness in the vasoconstrictive phase. This is followed by throbbing, burning, aching pain, tingling, and swelling in the hyperemic phase. An episode usually lasts only minutes but may last for several hours. The symptoms may be triggered by cold exposure, emotional upsets, tobacco use, and caffeine. After frequent, prolonged attacks, the skin may become thickened and the nail brittle. Complications include punctate, that is small hole lesions of the fingertips. Occasionally, there is superficial gangrenous ulceration of the fingertips, which is seen most common in autoimmune disorders. The manifestations tend to be bilateral and symmetric and may involve toes and fingers. Echyrocyanosis is differentiated from Raynaud's by a relative persistence of skin color changes, symmetry, and an absence of paroxysmal pallor that is found with Raynaud's. Almost all patients with echyrocyanosis have marked clamminess and hyperhidrosis of their hands and feet, which tend to worsen in warmer temperature while the color changes improve. Finger color normalizes when the hands are transferred from the dependent to horizontal position. Symptoms of Raynaud's syndrome are episodic. That means they come and go. A typical episode or attack lasts about 15 minutes. After warming up, the return of blood flow to the area can take 15 minutes, but attacks may be shorter or longer. Symptoms are usually mild in people with primary Raynaud syndrome. People with the secondary Raynaud syndrome may have more severe symptoms, including skin ulcers. Raynaud's syndrome can typically diagnose from the symptoms. The provider may ask to take photos of the skin changes when they happen. The provider may also perform a physical exam and ask about the medical and family history. Tests may be done to rule out secondary disease processes such as chronic arterial occlusive or connective tissue disease. It is usually easy to diagnose, but it may not be obvious whether a person is having primary or secondary form. That's where diagnostic testing can help. One test that is particularly useful is a nail fold capillaroscopy. For this test, the provider places a drop of oil on the skin at the base of the fingernail. This spot is called the nail fold. During the test, the healthcare provider uses a microscope or magnifier to look at the nail fold for anything unusual on the skin at the base of a fingernail. This might include swelling of the blood vessels. If the capillaries in the area are enlarged or abnormal, patient may have a connective tissue disease. Nail fold capillaroscopy test can tell the difference between primary and secondary Raynaud's. Blood tests can help find out whether another condition such as an autoimmune condition or a connective tissue disease is causing Raynaud's. One blood test cannot diagnose Raynaud's. Other tests such as those that rule out disease of the blood vessels can help find a condition that can be related to Raynaud's. Blood tests for Raynaud's might include anti-nuclear antibodies test, also called ANA test. A positive test results often means that the immune system is mistakenly attacking body tissue. This is called an autoimmune reaction. Next test is erythrocyte sedimentation rate or ESR test. This test shows the rate at which red blood cells fall to the top of a tube. A faster than typical rate might signal an inflammatory or autoimmune disease. It helps diagnose rheumatoid and autoimmune disorders, among other conditions. CBC or complete blood count test can check for a range of conditions. Pulse volume recording is a non-invasive test that checks blood flow in the arms and legs. These are the tests that can help the provider identify or rule out underlying conditions as causes of Raynaud's symptoms. Now we will discuss about the management. Treatment depends on the severity of the condition and whether a person is having the primary or secondary form. Dressing for the cold in layers and wearing gloves or heavy socks usually can help mild symptoms of Raynaud's. Medicines can treat more serious symptoms. The goals of Raynaud's treatment are to prevent Raynaud's attack, help reduce the number and the severity of attacks, improve the quality of life, treat the underlying condition or disease if a person is having secondary Raynaud's, prevent skin ulcers and tissue damage. For many people, lifestyle changes are enough to manage their condition. These include avoid cold spaces like the frozen food or extreme air conditioning. Avoid touching cold objects like glasses of ice water or cold metal surfaces. Manage stress and strong emotions that could trigger an attack. Wear warm clothes during cold weather. Depending on the cause of symptoms, however, if a person is having severe symptoms, may need medications. Sustained release calcium channel blockers are the first line drug therapy. They relax the smooth muscles of the arterioles by blocking the influx of calcium into the cells. This reduces the severity and frequency of vasospastic attacks. If symptoms persist, other vasodilators or topical nitroglycerin 2% ointment may be used. Calcium channel blockers can be taken with nitroglycerin topical ointment. These drugs also can help heal sores on fingers or toes. Longer-acting calcium channel blockers are frequently used to prevent or reduce vasospasm. Examples include nifedipine, amlodipine, felodipine, and isradipine. Next drug of choice is alpha blockers. These drugs counteract norepinephrine, that is a hormone that constricts the blood vessels. Alpha blockers help dilating the blood vessels. Examples are doxazosin, prazosin, and terazosin. Next drug of choice is vasodilators. These medicines relax blood vessels. They include the high blood pressure medicine losartan and the erectile dysfunction medicine sildenafil, antidepressant medicines fluoxetine or Prozac, and a class of medicines called prostaglandins. Antiplatelet agents such as aspirin or dipyridamole may be given to prevent total occlusion. Nitroglycerin or sympatholytics such as reserpine, gonadotropin, or prazosin may be helpful for some patients. Adverse effects such as headache, dizziness, or orthostatic hypotension may be present in some patients. Nitroglycerin skin ointment is a cream that can apply to the fingers to help heal skin ulcers. Prompt intervention is needed for patients with a digital ulceration or critical ischemia. Treatment options include prostacyclin, infusion therapy, antibiotics, analgesics, and surgical debridement of necrotic tissue. Botulinum toxin A and statins may lessen the severity of Raynaud's phenomenon. Surgery might be needed to treat serious Raynaud's. If a person is having severe Raynaud's and other treatment methods don't work, the provider may recommend a procedure called sympathectomy. Nerves in the hands and feet control opening and narrowing of blood vessels in skin. A sympathectomy temporarily blocks or cuts tiny nerves near the affected blood vessels. This prevents the nerve from sending signals that make the blood vessels get too narrow. The procedure should relieve the symptoms for 1 or 2 years, but patient may need it again in the future. Next treatment option is chemical injection. Shots of numbing medicine, that is onabotulinum toxin A, that is also called Botox, can block nerves in affected hands or feet. Some people need to have this more than once if symptoms remain or return. Complications of Raynaud's are chronic disease may cause atrophy of skin and muscles. Ulceration and gangrene may rarely seen in some patients.